So I saw a friend at the grocery store last week who told me he had a rotator cuff surgery coming up and he wasn't sure whether he should go through with it. So I asked him whether he'd been to physical therapy, and he said yes, at one of your locations with one of your amazing physical therapists, but he didn't get better. So I asked him if he's still doing his rotator cuff strengthening exercises, and he said no, but he swims. So I told him you have to keep doing these isolation exercises for the rotator cuff for this thing to get better, and it can take 12 weeks. When you tear that rotator cuff, it's typically the top tendon gets torn. If it gets torn all the way through, full thickness tear, this will actually separate. So you're not going to be able to strengthen right there where that tissue is torn, but you're trying to strengthen the adjacent tissue. And this can take about 12 weeks to do it. I've seen cases get better. Here are some of my favorite rotator cuff strengthening exercises. Scaption is my favorite. Don't go above shoulder height with that one. Also, don't push through pain with these. If you need to abbreviate the range of motion, do that. 2 sets of 10 to 20, 3 times a week. Not quite this speedy.